Thank you, Hindi team. Thank you so much. Now we are moving to English session. I'm welcoming all of you to our English session. Before beginning the session, we will have a silent prayer. Good evening and welcome once again. Thank you all the participants for making this webinar as a success. Your participations inspire us so much. And today is our 1676th day of continuous webinar. Today's our guest is Dr. Asha Varghese. She is very familiar to us and she has taken many classes for us, even very interesting classes. And she is the daughter of our Dr. Ambadi, Ramadevi Ambadi. And now today she is going to take, she's a successful practitioner in Bangalore. When I was going through the address Mohahalya in our movie, in our one of our Malayalam movie, there is Mohanlal is saying some Halli, like in her place, it is some Halli. I don't remember the place. Okay, even though I'm welcoming Dr. Asha Varghese to our webinar. You're welcome, doctor. Today she is going to take management of personality disorder. Actually, that is a very important subject. Everyone have to listen from the beginning till the end because many of us are suffering from personality disorders, but we don't know even we are having such complaints. So please listen and she will do her job well. Thank you all the participants and thank you Dr. Asha for coming and joining with us. Dr. Asha, you are welcome. You can you are not I'll make you as a co-host. Sorry.
Yeah, it's unusual.
I thought why you are not talking when I am asking about the Mogahalli and all.
The thing is, it's Kundanahalli, and Halli means village, but unfortunately, that is one
village.
of the village.
Okay.
Yes, but that is one of the poshest village I have seen, I should say. And there are no more Hallis in
Simply
Bangalore.
saying the name as village and facilities as like.
Yes.
Okay, doctor. Okay.
Is it visible, please? Can you just look at it?
Visible. Yeah.
Thank you all. The topic for today is personality disorder, as you can see. I've introduced a few, cartoons into this, so it'll be a little interesting for everybody. And I kind of like to learn it with cartoons and drawings and all the stuff. So I have implemented the same into this session. Okay. So today's topic, as I said, and thanks to all my gurus and all the elders in the group, first and foremost. And with a small prayer, let us start it. Okay, so today's session is personality disorder. First, I'll explain what is personality disorder, and further, I'll explain about certain cases with each of the drugs. So whatever medications has been given, then I'll give you the brief about certain cases. Personality disorders are mental health conditions characterized by inflexible and unhealthy pattern of thinking, feeling, and behaving that can cause distress or problems in relationship. These patterns often emerge during adolescence and can persist into adulthood. Teens with personality disorder may struggle to understand and relate to others, leading to difficulties in their family connection, social life, and academic progress. Common signs and symptoms: difficulty regulating emotions. This can manifest as intense and frequent mood swings. Everybody is familiar with that. Episodes of rage or difficulty managing anxiety or sadness. Unstable relationship. Teens struggle to maintain a healthy relationship, fearing abandonment. There will be a case which I'll be telling you about it. Experiencing difficulties with trust. Impulsive behaviors. This is another one we'll be taking today. This could include reckless driving, substance abuse, or engaging in risky behavior without thinking about the consequences. Self-harm or suicidal thoughts. In some cases, teens with personality disorder may engage in self-harming behavior or have thoughts of suicide. Difficulty with self-image. Teens may have a distorted or unstable sense of self, leading to feelings of emptiness or a lack of direction. So the thing is, I have done my MSc in counseling and family therapy, and the internship was in a place called Spandana Mental Health, clinic. It's hospital. And now I'm doing my PG diploma in mental health itself. So again, we come across many of these cases where the children do personality disorder, borderline personality disorder, we call it, where they cut their hands, etc. So the thing is, we have basically heard of the fact that women are from Venus and men are from Mars. Believe me, these kids are from a totally different planet too. So nobody seems to be understanding each other's language is a fact. Types of personality disorder in teens. Borderline personality disorder characterized by instability in relationship, self-image. Self-image, I don't know, there is a new web series going on in, I think, Netflix. It is called Adolescence. It shows about how the child is, made fun of, how he does not have a girlfriend, makes it very important. That's a web series from US. And how this child ends up, murdering another child, okay? That is something I think we all have to probably watch. I'm not trying to advertise it, of course, but things which we don't understand, the emojis they send, which is very harmless, but it has deeper meaning in it. Inceleb, that is involuntary celeb is another terminology used, which we'll not understand. So there are many terminologies which are used and which tampers with their self-image, emotions, with potential for intense mood swings, impulsivity, and self-harm too. Narcissistic personality disorder. Teens with this disorder may have an inflated sense of self-importance, a need for excessive attention, admiration, and a lack of empathy for others. Narcissist personality disorder, there are many couples with this kind of, the way they come and they say, I think my husband is on the borderline narcissist doctor. So this is a terminology with many women know nowadays, or they would, the other way around, I have heard less, but I would say men, females mentioning men as narcissistic and they themselves as empath is something we come to hear very regularly. Histrionic personality disorder involves excessive emotionality and attention-seeking behaviors, with teens potentially feeling uncomfortable when they're not the center of attention. Other types include paranoid schizoid, schizotypal, and avoidant, dependent, obsessive-compulsive personality disorders can also manifest in teens. Why is early intervention important? Early diagnosis and intervention can help teens develop healthier coping mechanisms, improve their relationship, and reduce the risk of long-term problems. Early intervention can make a significant difference in their long-term well-being. Unfortunately, when I had gone for my internship, most of the people over there, many of the people are the well-educated people who are not able to cope up, probably like severe brain fag leading to issues like, zincomet, etc. We know they have all these schizophrenia, etc. So those kind of coping mechanism, bad coping mechanism is how I can term these, diseases of today. Now, the second thing is like why we have to intervene and prevent the further complications is there are lots of murders, lots of things happening in the society, either because they feel ashamed or they do not feel accepted, etc. Peer pressure, whatever. Okay. So the first case I'll be taking up is medorinum. It is a psychotic miasm. Frankly, it is a psychotic miasm to tuberculosis miasm, I should say it is. Okay, because they love to have fun and all. Prepare from the gonorrheal discharge, suppressed gonorrhea, it benign growths like Tuja, even they have growths. So psychosis is everything in extreme abundance. Every growth is so much like, too abundant. Does everything in excess. So medorinum is ultimate party animal, the passionate adventurer. Now we can see generally what we all believe that, like, in beaches, there would be lots of drugs, alcohol, partying. They love beaches. And generally we find it in those beach areas is how we probably think party is, right? So this is a picture I have depicted over here. Physical appearance. Face is broad, showing an open temperament, angular outline, straight line, which shows a strong intelligence. Okay, very important. The Medorinum person is above average intolerance. He's an all-rounder. Dreamy eyes, full lips, long eyelashes. See this, even for a young girl, she might look a little mature than her age. Excess body hair in men and women, heart patient, serrated teeth in children. You would have seen that some children have serrated teeth, like small spikes, thick lips due to mouth breathing. Does everything in excess, ultimate party animal, sex, drugs, rock and roll, great appetite for life, for experience of all kinds, just to see what they are. They are fearless adventurers, seeking information about the world. This is the difference between tuberculum and, whenever I remember points, I'll just let you know. Tuberculum is a little fearful. He has a fear. He might be very naughty inside, in this at home. But in school, there are chances that he will behave a little, controlled in a controlled way. But in Medorinum, you don't see that. You don't see them. You don't see them being under control. They are pretty fearless. So this is a depiction which I have given you. So I've given lots of pictures so that we will recall and remember the drug very easily. Stays up all night. Okay. So in Medorinum, we have a rubric which says amelioration night, aggravation daytime. So this boy or a girl, he would stay up all night. Indulge. Why night? Night is a time when there is no one to observe them or to control them. They stay up all night, and the next day morning, daytime, they're aggravated because they did not sleep well. They get up in the morning, they're irritated, they are aggravated in the morning. Drinks too much, indulges in sexual cravings with a strong libido and no self-control. Young children with increased sexual drive and masturbation, religious enthusiasm. See, anything they could do it overboard. They can become very, very religious, very spiritual, everything is in extremes. They reach milestones early, hurry to explore the surroundings, precautious, good at verbal skills. They're not shy and can talk to complete strangers, resents restrictions, disobedience, and alternatively charming, delightful children, boundless energy. They'll keep on questioning us. Cruelty for fun's sake or just to flex muscles in order to gain a sense of power. By the time he reaches adolescence, this reduces. See, what happens is when they are young, they do lots of these things. And by the time they're adolescent or probably a little older, all this reduces. So you might see a person, if you ask him questions as, do you drink? Do you smoke? I mean, whatever his, history is, habits of present, you might not get Medorinum. So it's always important for us to ask how his earlier days were. That is where you can get a Medorinum, because later on, as the adolescent comes, he feels, I have lived my life. Passionate, adventurous, they learn a great deal from diverse experiences. See, we learn from book. They learn from experience, practical wisdom. Everything in excess, nervous exhaustion, tremors of workaholics. So this can even be given for workaholic people, just like Zincomet and many other groups. Night owl, crashes, burns after very high energy level. They are dreamers. They are all-rounders, strong sensitivity. They are artistic, lover of beauty, loves nature, weeps easily while narrating his symptoms, weeping amelioration. So what are the other drugs? We see Calicarbi is there, Pulsatilla is there, Sepia is there. All these people will sit and weep. But this weeping will ameliorate. Risky games, car racing. This is another depiction which I have given. Young children with increased sexual desire and masturbation. So this, I'll tell you a case which I have presented it in the Hindi session. So in this, there was a girl who had come with PCO. So PCO with, she was a very intelligent child, very precautious and all. And something in her, I mean, she came with her mother, and she was dressed up in a way in which I felt like, she was probably a little older than her age. I felt she was in her probably 18, 19. Then I came to know she was around 12, 13 or something. And so she had a very low neck dress, and she was completely dressed up, lots of jewelry and all this stuff. So even I was a little surprised. And then when I checked out her earlier days, the mother said that when she was very young, she had itching of her vagina. She used to keep on, that is before 3 years. Okay. So in Dr. Bailey has written that they'll have increased sexual desire when they're very young, followed by a period of not much of, the drive. And then again, they would be having a sexual desire, which is increased. Sexually precocious children are fascinated by their own genitals and by those of other children, and therefore engage in sexual games. Girls flirt with men in a confident and natural manner, like a mature woman. High sex drive, hunger for different experience, even to homosexuality or bisexuality. See, this is again seen in Tuja. Later on, I think later on classes, we'll look at Tuja. But in Tuja, what happens is they are very ashamed of the fact. So they will have two masks. One mask is like a daily, whatever they are. And another mask might be, that they are bisexual or homosexual. So later on, if I get an opportunity to do it, we'll do Tuja. They have many such sexual encounters in the youth, but maturity settles down with heterosexuality as mature. In the sense, like, I'm sorry. So here it means that earlier days they will have a high sexual encounter, homosexuality, although they'll be very experimental, but later on they'll become heterosexual and have lost the hunger for different experiences. Late night person, alive at night, stays up all night and increase appetite time. There is a case, there was a child who had come, and he was like very, very smart child, but he was getting addicted to games. Okay, so his mother bought him, and they used to say, doctor, like, he was earlier very nice, and then he was very addicted to games. So he was not very old, I think 14, 15-year-old. And I was talking to him. So he was, something which I have not written over there. He was clenching his fists like this and sitting. Okay. So there are two predominant remedies for that. One is hyoscyamus and medorinum. And second one was, when I started asking him questions, he was like a little weepy. He said, initially he was not opening up, but later on when I asked, and he was like, my dad is very, my father is very dominating. He'll keep asking me to study. I used to study. Even if I study, they're not very happy. And that this and all started up. So then later on, like he was, and I said, like, what do you do? He says, no, we have a group of friends. We play games, like, so it is like a, I don't know, combined game together or something. All of them together sit and play the games. So in the morning when he gets up a little, he has to go to school. He'll be very irritated. Okay. And then in the night, his mother was telling, he's like a cockroach doctor. He'll go in the night and he'll be raiding the fridge. Okay. So this is one case. And after medorinum, and of course, after a bit of counseling, etc., the child, started getting back to his routine. His marks and all started coming down. So later on, I think we made it like, it will be so and so, so many hours, etc. Okay. And these guys are very fearless. Medorinum guys are very fearless. So when the father, tells them not to do, etc., they don't give heed. He will not give heed. He will sit and do. Though he's angry and he will be tearful and all this stuff, but he will still sit and do. Extremes of temperament. Okay, so now we looked at one part of the Medorinum, which is an extrovert. So you have everything. They are an introvert, they are an extrovert, they are kind, they are cruel, they are intelligent, they are detached to highly emotional and intuitive people. They are another thing. They're very clairvoyant. Like, they will know what is about to happen. Like, it's like an intuition they feel. And they'll say, like, doctor, I was feeling like that. Down to earth people, self-satisfied, but they can be down to earth people also, and they can be self-satisfying and satisfied and boasting people. Enthusiastic, ready for action. Daydreamers, the lazy type also they can be. Sympathetic, irritable, self-centered. Medorinum is not as stubborn as tube. Okay, tube is stubborn kids. They are like they'll roll on the floor and they'll kick and hit and all those. That much is not there in Medorinum. Free thinkers, therefore they are not loners. They enjoy stimulating company too much. They get along with all kinds of people, warm but not possessive. Loves animals, gets very attached to animals, hurt animals when upset. Yeah, I told you about the PCOD case. The child had a cat in a house. So what she used to do is when, she used to be very lovey-dovey and all this stuff. So whenever they used to shout at her or say something, she'll go with the cat and she will not come out of the room. She'll be sitting there with the cat. Like full time, she'll do as if like cat is her, sibling or something. Then she will go and hit her brother. Like, she'll be very loving to the brother. But when something like this happens, she kind of, it's, the very animal, if someone, even kicks the bowl, like, with the cat has taken, was eating from, she will like, tell them like, it's the cats, so you people don't give enough, this is also part of our family, etc. And that same animal, she'll just pull this one and she'll hit it off. Sometimes playfully she'll pull the cat. So mother's a little confused. Like, I asked, she loves animals and all this stuff. She was like, doctor, I don't know. This is what she does. And she will even go and harm her brother. She loves her brother very much, but she gets irritated. She'll go and, do something to irritate him. So in Medorinum, we have desire for grapes, oranges, orange juice, citric fruits, green fruits, crunchy apple, sweet, sour, salty, sour, ice cold drinks, alcoholic drinks, fatty food, potatoes. So we can think of a beach situation where there are all these drinks are kept. Of course, they have a craving for ale also and alcoholic drinks, all these. Aversion to slimy things, eggplants, okra. So slimy things, even natramur we can think of. Hunger soon after eating, like Cinna, Lycopodium, Sorenum. Increase appetite at midnight. I already discussed it. Aggravation daytime, amelioration of all discharges. So many times you might think it is like so many other remedies. Children who are good in sports, studies, art, romance. Other medicines are lachesis, lycopodium, naxomica, sulfur. So we know lachesis. So many times we might even think that Medorinum looks a lot like lachesis. They are also very lively. They also like to dress up. They are also loquacious. They are also talkative. But a predominant thing in lachesis is these people are very jealous kind. They are, So the child initially I thought it was sibling rivalry, but not exactly for that other child with PCO. She was more like she was very fond of him. Like if she goes away, etc., she would like, not allow all this. She would not even allow her mother to shout at the child, etc. Lycopodium. Like no confidence, fearful, naxomica, irritable, too much irritable, sulfur. Yeah, all like, we know all the drug pictures. Intelligent children with good grasping power. Disobedience whenever sound advice is given to them, as in like whenever you tell them, like say, like I said, there is a parent who's very strict, so what happens is they would say, the moment the father will say like don't do this or don't do that, etc., he would not listen to them. Tendency to get spaced out. This is another thing in Medorinum, very much like cannabis and all. They get spaced out. They'll be dreaming, like, they'll be in their own dream. They will forget common words, common sentences, etc. Medorinum children, like, in the midst of a conversation, they can get dreamy. They'll get spaced out. They will be like, they will even forget their own, friends' names. Sometimes they can even forget their own name is what has been written in certain books. Cannot remember what has been said, forgets homework, etc. So these people, they can run up a stair to get something, forget what they were supposed to do. They'll come back with the same speed. That can be Medorinum. Okay. And of course, lack and all the so many are there, shopping and they forget, etc. But Medorinum is more like a bubbly, lively child. So next thing is nail biting, which is a very important thing in Medorinum, which other things are aurum trifilnum, Verita carp, carcinosin, Carbovec, Plumber metallicum, Veratramal. In this, there is one rubric called, oh, I'm sorry, vomiting constantly during paroxysm. Okay. So what happens is they'll keep telling their symptoms, they'll keep in paroxysms, they will keep telling. Vomiting can be a depiction of like talking or telling about the symptoms. They'll keep telling their symptoms in paroxysm. They'll say they will cry. They will say they will cry. So they will be vomiting it out little by little. They'll be telling, hopelessness of recovery. Another thing with medorinum is, imagine a person who has been, he drinks, he smokes, he's done everything. And now, and medorinum, we know that, the sex outside is what unsafe sex, etc., because it is a gonorrheal, discharge. So now what happens? Now the person gets gonorrhea or any STD, if suppose there is a hopelessness of recovery. Cannot speak without crying. It has been told earlier, Kalika, Pulsatla, Sepia. But in medorinum, crying ameliorates. Nervous, restless, fear in the dark, sense of being out of control leads to a kind of panic, which leads to hurriedness of both action and thoughts. Other remedies are lachesis and alumina. Lachesis we already know, and alumina is like a very dry person. Okay, very dry, and we'll speak about lachesis also later. Melancholy with suicidal thoughts, always in a hurry, doing something, and crashes and burns after high energy level, both emotionally and energy wise. Okay. So they're always in a hurry. They'll keep on doing something, and ultimately they'll crash and they will fall. I mean, they will come down. Merxol too has the same indications. Hurry, but no fatigue is not there in Merxol. They are not as fatigued as Medorina. Here I have told you, wears fashionable amulet, rings, wristbands, earrings, etc. Precocious, talk and precocity of children. They look much older than their age. They're like dressing up in, very fancy dresses, very attractive dresses, etc. History of a parent who always reproaches and is not able to understand the feeling and emotion of the child, which makes the child withdraw, take some, Now, after he becomes withdrawn, he'll take some winter word for fantasy, mind dilution, unreal. Everything seems unreal now. I told you they'll get a little spaced out. They might just go into their own dreamland. So, see, there is a depiction again of a small child seeing faces in the dark. Okay. Sees faces in the dark with vivid imagination. That is also seen in phosphorus, stramonium, etc. Fear of what lays in the depth of the ocean. Okay. They are very, first and foremost, they are very curious. They want to know everything about everything. Now but they're scared of what will lay in the depth of the ocean. Fear of someone behind her. Delusion that someone or something is behind her. Fear that something bad will happen. See, I told you they're very clairvoyant and they they're very intuitive. Fear of going crazy, insanity, and strong imaginations. Warm-blooded, feet feels warm. Okay, so while they're sleeping, they put their feet outside the cover. Sleeps with the feet uncovered. Aggravation, damp, cold weather. I'm sorry about the spelling mistake. Psychotic miasm. Spelling mistake again. Amelioration, bathing in ocean. Asthma, eczema, it's all ameliorated in sea air. So think of a person who loves to go to the beach, etc., party. So we can think of a person who will get ameliorated in the sea air. Here in Medorinum, there is a dream of drinking water. Very peculiar dream it was. So I just wrote it down if anybody gets a PQR ever. Okay. So next one is chronic diseases manifesting at an early age. Juvenile rheumatoid arthritis, heart diseases in young adults, genitourinary complaints, nervous complaints, skin and mucous membrane, musculoskeletal diseases, cystitis, urethritis, vaginitis, chlamydia, PID, pelvic inflammatory diseases, nephritis, urinary tract infection, STD, sexually transmitted diseases, leukorrhea in young girls. That is very predominantly seen in Medorrhinum, much younger than what we expect them to have. Orchitis in male, epididymis, prostatitis, urethral discharge, stricture, again a spelling mistake, sorry, genital herpes, warts. Discharges have a fishy odor, chronic coryza, and a post-nasal drip. Sinusitis, asthma aggravation 2 to 4 a.m. like Kali carp wants to be fanned like carbovag and lachesis. Suppression of discharges aggravates chronic bronchitis, asthma, and the sleep position is generally knee-chest position. Sleeps on back with hand overhead. These two positions can be seen, which is seen in Lacaninum, Naxomica, Platina, Pulse, Viola T. Bites tip of the tongue during sleep. Even after a short sleep, they'll wake up as if they had a full sleep. That is seen in Acid Floor and Naxomica. So you take a siesta or a just small nap in the afternoon, and they wake up as if they're very fresh, ready for the next, thing to do. Ocean amelioration, sea air amelioration, sensitive soles of the feet. Yeah, this is another thing. I had a patient once who used to say that I can't walk on bare foot on the floor, normal tiles and everything. I can't walk. My soles are very sensitive. Many, medicines are there, but that patient felt better with some Medorrhinum. Perspiration of foot, aggravation winter, which is seen in Argentum nitricum also. Diaper rashes, infants, swelling of ankles. Swelling of ankle, I get very good results with Medorrhinum, Ledempal, etc. If it is like a bit of swelling is ascending upwards, Ledempal also gives very good results. Constipation, must lean backwards to pass stools. Pain, passing stool, like a nightmare, brings tears to eyes. There's so much of pain. Frankly, I never thought of Medorrhinum for rectal pain. I used to think of more like nitric acid and those kind of Aeschylus, aloes and all. But Ratania, there's another excellent medicine for that. But Peonia. But constipation with backwards, they have to lean backwards too. That is like they're straining the stomach. They'll push it in the front, and the body they'll push it backwards. And so much of pain while passing stools. Leaning backward, and that releases gas is, leaning forward, releasing gas is lycopodium. Rubrics, what are the rubrics that we'll take? Ailments from anticipation, sensitive, reprimand to, fear, misfortune of, anxiety, time is set if a. So if you set a time, they'll get a little anxious. Hurry, they will hurry, and they'll ensure that they will hurry everybody around you. Time passes too slowly, appears longer. Washing always her hands. There is another case, OCD case it was. Oh, that was a nice case. Washing always her hands. I generally thought of syphilinum and, syphilitic remedy and all. So this lady, she'll keep washing her hand. So the history is like that. She got married, and she's with her husband now. So earlier, she used to be in love with a guy, with a person, and he did not, he did not get married to her, and he used to insult her, etc. So a very lively, happy child suddenly became like, she became very moody and everything. Okay, so that was the case. And she used to keep on washing her hands. She used to feel as if she's done some crime, like by getting married to this second person while she was in love with the earlier person. But, I was like, do you still miss him? She's kind of, okay, yes, I do miss him. So initially I thought Ignatia, she used to cry. But Ignatia was just giving her temporary relief. But then later on, after I gave her Medorrhinum, I found a good relief in her case. Anxiety of conscience, as if guilty of a crime. So that's why I just put these two, rubric also, so that we can discuss about this case. Delusion that someone is behind her, fear dark of, fear death of. Okay. So the second one is Lysinum hydrophobium. I wanted to put anacardium along next, but this was a case, he felt better with this medication. So I thought I will just take up this case first. So it is a nosode and, from the rabbit dog, and rage and torment is the keynote over here. Okay. So now look at this. This is a master who's beating up the dog and the dog is attacking him. Okay. This is a picture of Lysinum. Okay. So this pair, there was this child, this is a very sad case. There was this boy, very young, and he was a normal, nice, good child, So he was put in a hostel. Okay. He himself volunteered to go to an hostel, in fact. Okay. He wanted to see how it is. So he went to the hostel when he was in 4th or 5th standard. And then what happened was, after that, after 1 year, he felt he did not want to stay there. He was missing his family. He wanted to come back. Okay. Now, but the parents, they said, no, you continue there in the hostel. We don't want you to, because you will be distracted if you come here. You're studying better, etc. And this child became very timid. Okay. The lively child became very timid. And he used to say, like, doctor, I don't even talk to anybody. I was like, if someone shouts also, I will not react, etc. So this boy had come for some other ailment. I think a headache it was, yes. Headache, migraine headache. And he used to get aggravated by sunlight, by noises. Then sometimes he used to say, doctor, so much that I didn't even want to take a bath. So I never thought it as, aggravation, running water or whatever. So I tried many medications. Then one fine morning, he told me something. So this boy, he came back from the hostel to his house, like after 10th standard. And he was angry with his father and mother because he thought that they are the ones who did not bring him back. Okay. One fine morning, what this boy did was, he took a knife and he went to stab his father and mother. And then they had taken taken him to a psychiatrist, where he was diagnosed as, schizophrenia, psychosis with schizophrenia, and he was given some medication, etc. So he said, doctor, I did not even, and immediately he said sorry to his parents. It was like very impulsive. The father said something, he just took a knife and he went to stab them. And, he went to assault the mother too. Okay. So, and then when he was saying that, he just was wincing. Even he can't even think of what happened that day. So initially, I was thinking of probably, Staphylococcus aureus, where he was taking in everything very mild and he was not at all reacting. Then I thought probably stramonium, but stramonium is very clinging. Okay, they are very clinging. But in Lysinum, and after that, he grew up, he said, like, I wanted to stay away. So that is one thing which is seen in Lysinum. Another factor he said was, I always feel that I want to jump from a tall building and commit suicide. Okay. So I was again thinking of argentum group, argentum nitricum, aurum metallicum, I thought of the regular medications, but he was not fitting into any of those. He was sitting and calmly telling me the story. So sometimes what happens is, like, we get confused with so many medication as to what it is, etc. So I just looked out for, I was referring so many books to see if anything is there where a suicide from height. Then I said, only suicide from height. He says, yes, I feel like going on top and jumping from top of a building. Okay, so I'll just finish off. Then you will see all the rubrics over here. Lysinum belongs to acute miasm, remedy of the animal kingdom. It represents only one aspect of the dog, the tremendous aggressiveness that has gone out of control. It is a state of a controlled animal gone crazy. The dog that obeyed the master but was treated so badly that it lost all its control and jumped and on and tore at its own master. This is, I have taken it from Soul of Remedies, Rajan Shankaran sirs. In that, the main feeling of Lysinum is of having suffered wrong, being tormented, especially by one whom he has served and has been faithful to and is dependent on, therefore creating an intense feeling of rage and anger in which the person can bite, strike, and even violently mutilate. See, many times we will see that in today's society, these children attack the parents back when they are like very aggressive. Okay, so we can think of lysinum because lysinum is an acute medication. Okay, so like stramonium, belladonna, I can think of, but then they'll try to escape. So belladonna is like that. Stramonium is a clingy type, as I said, like again, violence is as predominant as lysinum. Often this rage is followed by repentance as profound as the rage was violent. Or it may be an impotent anger which can lead to an impulse to stab himself. Like staphysagria, they're not able to express. Now he wants to stab himself. Lysinum is required in a situation where a person has to lash out against somebody because if he keeps quiet, he will be further tormented. So this is a scenario which are seeing of late, like many times. Like I have seen another child. I gave him staphysagria of recently before he would turn into a lysin. I hope you understood like where we can intervene and help people. The father is very dominating, like when anacardium. He's also my patient. He's getting anacardium now. So he is like, he will control. The child should not even put a perfume. If you put a perfume also, he'll be like, why are you putting on the perfume? What are this? What do you mean? You're bathing in perfume. He is not supposed to, he's 21, 22 years old. He's as old as my son. And he was like, why do you want to like go out with your friends? These are the kind of, so this child comes, he's like very quiet, very scared. He says, doctor, I'm already 21. So I said like, Beta, like, why don't you talk to your dad? Like, I would like to go out with, and I would be probably within my, if you do not want me to drink, etc. So I will ensure that I don't do it, but I want to go out. So why don't you talk it out? He says, I'm so scared. I don't want to talk because he will flare up, and his flaring up scares me. So tomorrow, before he becomes into lysinum or belladonna, stramonia, we can always intervene. The first line of people who can help these children more than any other system are homeopaths. But this rage has to be followed by quick repentance, because if it persists too long, it is not good for him, as he, after all, is dependent. Okay. So why this child is repenting, or there is quick repentance, is because this child is dependent on the parent. So you can look at this dog. He's repenting because this is the only person. He's in the house. He's tied up, and we give him food. And so if he suddenly gets violent one fine morning and he bites, the next reaction would be like, repentance. This my doggy, he's roaming around. I think he understood. The heightened sensitivity of lysinum, as for example, to light and noise, is character feature of its alertness. Faithfulness with alternates with the violence and destructiveness. Kill me, I can't take it. I don't want to live. Give me a knife. I want to stab my arms. Why are you doing this to me? So these are the statements you will hear from lysinum. They would even say this to God, like, God, why are you punishing me? So this is the kind of statements, either you will hear them telling it to you, the parent, or it would be to God. The lysinum situation is one of being tormented by something or someone on which one is dependent, a torment that is not merely an insult, but actually causes physical and mental pain. It brings about rage, an insane rage, wildness, fury, biting, growling like a mad dog, attacking, and then withdrawing. So there are so many other medicines. China feels tormented because of his boss, probably is continuously being made to work. Crocus is, what do you call that? We put it in...
Kumkumapu.
Kumkumapu. Thank you. Yeah. Kumkumapu. There was an English term for it, doctor. I just forgot. Saffron. Yes. So crocus is, crocus is like more like ignitia. Okay, they'll want to kiss everybody in the room. Like, they would be the kind who will kiss you and greet you. And, they also have rage with quick repentance. Okay, Drosera also feels deceived, cheated, trapped. Hell, belladonna, hyoscyamus, same reactions, feelings. Sensitivity to external impressions. Another thing with Lysinum is they have very high sexual drive, but they have sensitive vagina and penis, both. Okay, so they're not able to. So if they are even masturbating, they will complain of pain in the vagina. Excessive sexual desire with pain, like Medorinum, they also love to enjoy the world, but everything aggravates him. Sunlight, sex, water, everything aggravates. So all these love for all this is a psoric miasm. Now they are selfish, jealous, rage, that can be psychotic miasm. Violence, physical, sexual, emotional, that is syphilitic. It's a trio of all three miasms. Fear of dogs, fear of going insane, fear of running water. I made all this cartoon, which is okay. So what are the rubrics? Delusion, tormented, anger, alternating with quick repentance, attack others, desire to, aversion, water to, barking, growling like a dog, desire to cruelty, cut, mutilate, slit others, desire to. See, this is something, no, Lysinum can do that. He can really cut brutally. He's like very impulsive. He's not like anacardium. Should I do? Should I not do? He's not, sitting and thinking about, okay, I will, do this. I will later on after I'll buy a knife. I mean, he's not a planner. He's suddenly executing it, and he will execute it in such a way that he can mutilate, kill. So many of these cases could be because of all the suppressed emotions. Suddenly one fine morning, like a volcano coming out. Delusion, abused being. Delusion, attack, insults, defend themselves against imaginary. Delusion, dog, growls and barks. Delusion, wrong. Growling and barking is not literally like they're sitting and bow, like it's not that. Growling and barking is more like anger, and they're barking at you words. Okay. Delusion, wrong. Suffered, he has. Fear, dog off. Impulse, stab his own flesh with the knife. He holds to injury, frenzy, causing him to injure himself. Kill, desire to injure with a knife, impulse to, praying, sensitive, oversensitive to music. They have a great craving for chocolate, and they have an aversion to vegetables. Toothache during pregnancy, intolerance of water in any form, profuse salivation. We give this for Lysinum is one of the best remedy for, I don't think, did I write? Yeah, medicine for this one, dust allergy also. One of the best medicines for dust allergy. Lysinum with whatever, later on, whatever you feel, probably histamine, whatever you can give, but Lysinum has covered many cases with that. In Gunavante S, this is the only, author in which I found this rubric. Suicidal by jumping from height, jumps out of bed, both are there. Impulse to jump from a height, or a metallicum, argentum nitricum, it is, sorry, I've written met. Impulse to jump after an epilepsy is argentum metallicum. So this is impulse to jump from a height, argentum nitricum it is. I can't correct it now. So like these two people, or a metallicum, the person who has taken up so much of responsibility now wants to jump from a height. Argentum nitricum, the moment he'll go to the tip of it, he'll just feel an impulse. Let me just jump. Like that kind of impulse. Okay. That's all. Thank you so much. What's the time?
Doctor.
Yeah.
Now we have 10 minutes for a discussion. That's enough, I think.
I don't think there is anything much to discuss in this.
Yeah. But even though very wonderful, excellent session, it was very nice. It is. Actually, I was not thinking of the time. When you are stopping only, I was looking what is the time. And thank you so much for sharing such a wonderful class. And even though you are you proved that you are an artist, you're drawing cartoon and all. Very nice.
No, I did not draw any of the cartoon. I don't want to take credit. I was just taking it out of, Google, and I was putting it over there because I love to learn with cartoons and drawing and all. So I felt probably it will stay in our mind a little better.
Even though it is a wonderful presentation. And doctors, if you have any questions, you can raise your hand and ask question to her. I think nowadays every children they need one dose of lysine because everyone likes chocolates and they don't eat vegetables also.
No, I frankly, no, doctor, until we look into all these, like, and thanks to this platform, I literally, sit and refer and, we go through. But probably if it had not, maybe like going back and brushing all our, whatever we learned, etc. Otherwise, we don't tend to, we take it for granted that we know many things and,
Yeah,
that
exactly.
reading tendency had reduced. But thanks to all of you. And I am doing my post-graduation diploma in mental health now. So I have my exams also coming up. So anyways, for that, I have to study. And unfortunately, all the cases I saw in that mental hospital, many a times I felt we can, probably give some intervene with homeopathic medications, but unfortunately, that's the allopathic hospital. Many cases are such sad cases in which there is, yeah.
Dr. Eliamma John wants to ask you some. George.
Yes, ma'am.
Dr. Eliamma.
Doctor, I was listening your class. See, about the lysine and all, what is the potency and
yeah, any mental disorders, no, I will give higher potency only, ma'am. And medorinum, I don't repeat much. And lysinum also, in this, I repeated a little frequently than this one. And after we started giving lysinum, he said that impulse, that, that wanting to suicide, wanting to die, all those had reduced a bit. Okay. So like, and he was already on antipsychotic medications. His headache has come down considerably. But he can't, is it psychosis? See, psychosis cases, no, they are like very impulsive. They're like, you can't predict, having a psychosis person in front of you. It is not like as easy as a borderline personality, or because psychosis cases are the ones who needs lots of people around them to control them. They'll get I have seen a violence in it's a Marwadi person. I have seen the violence in them. So you can't literally wean them off medication, suddenly stop all the allopathy medicine. That's not quite possible. They will be on medicines throughout. But lysine has helped him with his headache and all the stuff. Quite a good relief he has. Then he was telling that I'm feeling much calmer. But I don't know. Sometimes I even prescribe back flower remedy. I have gone for the course, etc. of back flower remedy. So 5-flower, I give many of these people because basically the emotions are the same. From the time probably Stone Age till today, emotions are the same. Okay. So not many changes in emotions. Probably the circumstances are changing, but emotions are predominantly very Stone Age, I should say. From then on, we have the same emotions. So back flower, I prescribe quite a lot for lots of huge, most of my patients abroad, etc. I give them quite a lot of back flower. And my favorite is always 5-flower. Easiest, and everything is there inside that. So you don't have to work too much. Past, present, future, whatever, like, fears of all kind is being covered by that. Yes, ma'am.
Madam, even the potency, is it one more?
Higher potency, about 200. There's a disclaimer also I want to say, because in one of our IHMA group in which I was a president earlier, they had told that all these online classes, etc., people are misusing it. Okay. So there was a big discussion regarding that in the group. So there's a disclaimer. This is not a prescription. But higher potencies, ma'am, I think you're all aware that what the higher potencies is about 200, please. Yes.
Okay, then what about repetition?
Repetition, I had to, do it. I think monthly once I used to give him with sanguinaria, and many other medications were prescribed to him. I use tinctures also, ma'am. I'm not shy to tell that I use tinctures. I'm not that single remedy, that doesn't work for me so much as I'm not that great at mentals completely. So I do use tinctures occasionally whenever I feel the need with some acute medications too.
Even
because otherwise they will...
200 potency means how many doses you'll take at a time?
I'll give 2 doses most of the times. That is first night and second night. Generally, I give like that. That is something I've been practicing, and it seems to be giving me good relief, ma'am.
Thank you.
For, again, after 1 week, you will give?
No. 200. Then after that, sanguinaria Q, as I said, like some some
No.
kind of back or something I'll give.
I'm not worrying about sanguinary and all. Lysine, I'm asking repetition.
Lysine, yes, lysine, as I said, no, ma'am. Monthly 1 doses, 2 doses maximum, not more than that.
Okay, thank you, Dr. Eliamma. Now, Dr. Indranil raised his hand.
Yeah. Can Dr. Asha?
Yes, sir, I can hear you. Huh.
Okay. A question about lysinum. Actually, it was a good learning and revision for us about lysinum. And Dr. Gurwant is one of the very old writer. You had highlighted very good symptom of him, which he has mentioned.
Yeah.
Actually, it's prepared from a rabbit dog's saliva. Still, our hand hesitates to give lysinum with all homeopaths.
Yes.
So, what should we do if the complaints aggravate? How to control them? That is in the mind. So, can you put some view on this?
Sir, as I said, no, I use backflower remedy also. And aggravation of mind, I haven't seen much because that keeps it much under control. Backflower, that 5-flower remedy, from the time I've been using it, it's emotional. They feel very relaxed. You can even try it before a stage performance if you have any. Like many a times, I have experienced it. Yeah, so I haven't seen lysinum aggravating very badly, like, suddenly I haven't got any case like that in which I had to, they were violently, they would not bring him to me. Probably they might take him to a psychiatrist or somebody. If this is the kind of violence he has done.
Okay. Because this is an incurable disease by WHO. So our hand hesitates to use lysinum. That is the main point.
Yes, because I used to use quite a lot of Islam. Unfortunately, I don't know. Like for me, for dust allergy, that is my best choice. Like many times I have used lysinum, and with good relief also. Like many cases I have used.
Okay. Have you faced any aggravation in the symptoms?
I haven't, doctor. Frankly, like I haven't got until we are of course giving it too frequently. For even not children exactly, chronic allergy cases like long time, I have tried with lysinum. No aggravation per se.
Okay, no problem.
Dr.
Lysinum.
I think Dr. Indranil has finished. Can I move to Dr. Harinath Sharma? You can ask.
From Bangalore.
Okay.
My thing is, in terms of cruelty, antimony crude also known to be something similar to medorinum. Could you please slightly elaborate?
Yes. But I wanted to start with certain of this, and certainly I'll come to anacardium and antiamprote. Everything will come to if I get a chance, like as we keep on, because I think after anacardium, etc., all of us will go home and take a dose. After listening to the drug. So many medications are there, like which we can use for most of them. Like it's a wonderful medication, of course.
Thank you, Dr. Harinath. Thank you, those who asked questions. And I think most of the mental disease, they have aversion to bath, right? Is it?
Not exactly until they go into depression, doctor.
Oh, okay.
So mania, I don't know whether you're aware, but mania has different phases. Like it can either be, a phase in which they're very lively, happy, they do everything nicely. And then
in that phase also, they are showing aversion to bath. They are not bathing, they're doing that, talking to everyone, very agile, very...
But think of OCD, etc. No, they'll bath for hours together, no? One whole hour.
Yeah.
So they will not come out at all. So that is also mental, right? So we can't classify, as I said, right now, since I'm doing my PG diploma.
This is my observation. I was searching many of the patients, and they have aversion to bath.
I think in general, most of them don't like to take a bath nowadays. I can say that in a general term.
So I am generalizing it. Anyway,
See, most of the teenagers don't like to take a bath. I can say they're more into perfume and lipsticks and all, less of bath.
Yeah. That's about teenagers, and even though some I know many different cases, but everyone has
basically what you're speaking about.
Similar. They have similar habit. That is aversion to bath.
Most of them
different.
See, recently I had a case. She was from she was from the US. So she similar, like she went into depression because of certain things. And then, she does not want to take a bath. She doesn't want to get out of the house. Like one's happy person, like, it's always something shakes them up so bad that their personality itself changes.
Yeah.
So all this
But
is.
even in the mania period also I have seen, but if, sorry, doctor, now it is a time for the Malayalam session. We are
Yes.
moving to Malayalam session. Thank you so much. Come again and explain us
Thank
about
you, ma'am.
your cases. Thank you so much. Dr. Shaila, I'm inviting Dr. P. Shaila for moderating Malayalam session. Doctor, you're welcome. Thank you. Thank you all of you for listening us.
Dr. Rajini, please make Dr. Shaila and Dr. Riji co-host.
Sorry.
Dr. Riji, Rashid and Dr. Shaila.
And I'll make you as a host, doctor.
Okay.